Feds want your input on a problem many people have dealt with at the drugstore, a shortage of generic medications. The Federal Trade Commission and Department of Health and Human Services launched an inquiry to look at drug purchasing and wholesale companies. The goal is to figure out if they're holding up the supply chain for generic drugs. The two departments have allotted 60 days to gather public comments at regulations.gov.
To bring some perspective on this new inquiry, we have our 9 News medical expert, Dr. Payal Kohli, joining us this morning. Dr. Kohli, thanks for being with us.
Good morning, guys.
Now, the generic shortage isn't really a new issue, so why is the government only looking into this now?
You know, we sort of started hearing about this during the pandemic, and when we first heard about it, we thought, oh, it's a supply chain problem. We're not getting the ingredients that we need to manufacture the drug. That's no longer the case. We have the ingredients, but yet we have shortages of these generic drugs, and hospitals and clinics are having to ration out chemotherapy, pain medications, ADHD drugs, things that we should have at our fingertips. And so this really sort of raised a spotlight as to the why. Why is this happening? And we realized it was these middlemen that could be responsible for kind of creating almost an artificial shortage.
Okay, so the question, who are these middlemen and how are they creating this problem?
Yeah, so the way that it works is you have a manufacturer and then you have the purchaser, who's the hospital. But in between, you can have one or two middlemen. These are these group purchasing organizations and these wholesale distributors that basically buy these drugs from the manufacturer and then sell them to the hospital. But these middlemen are charging all kinds of administrative fees, asking for rebates, and basically making it so hard for the manufacturer to make any money on these generic drugs that a lot of the manufacturers are saying, you know what, I'm getting out of the manufacturing of these generic drugs because I'm just not breaking even.
Everything you're describing, how is this impacting your everyday American, and what can we do about this?
Well, you know, you can imagine. I mean, not being able to get the chemotherapy that you need, and I've had friends who've been in this situation who are oncologists who have to decide who they're going to actually give chemotherapy to for a generic medication. I mean, and so this is just absurd. And then it even goes to our everyday medications, pain medications, hypertension medications. This cannot go on and it really needs to sort of have something happen. So I'm glad that the government is looking at this, but we as people can start to speak up. So I would say the average American can even voice their opinion if they're experiencing a drug shortage. You want to make sure you don't let it impact your health so that you don't not take the medication.
Right.
And alternatively, don't let it impact your finances. So you're starting to go into bidding wars on these generic medications that are in short supply, and you're paying more than you should because that sort of propagates the process even more.
Sure.
I know some people, and I've had some impacts to this as well, and it's terrible when it's something you rely on, you know, and we're just seeing it so expansively. What else is in the pipeline for the FTC to tackle these high costs of these prescription drug prices? Because that's another thing. It's affecting our bank accounts too.
You know, I'm just so glad that this has happened in a way because now people are paying attention and they've got a whole agenda. So it doesn't just stop here. And have you ever wondered how your insurance company decides which medicines are covered and which ones aren't?
Right.
That's something called pharmacy benefit managers, another middleman who sort of negotiates prices with the drug company for the insurance company because they charge all these fees. The drug companies raise the price and it gets passed on to the consumer. So that's next in their pipeline. They're going to start tackling insurance companies and seeing why they decide what goes on formulary, what doesn't, how they decide that, and how they can lower the cost of some of these brand name drugs that many of us do need access to.
Yeah, doctors like you have been shouting this from the mountaintops for quite a while. Now it seems like everybody else is getting on board with this. Dr. Kohli, thanks for your time. By the way, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.